Welcome to Ortho Reports podcast. All right, today we've got a story for you that is, well, it's a real medical mystery. It's a brand new case that sits right at that fascinating and sometimes tricky intersection between amazing medical technology and the incredible complexity of the human body. So let's get right into it.
So just think about this for a second. You have one of the most advanced surgical procedures we've got, performed absolutely flawlessly. Everything looks perfect, on paper, on the x-rays, everywhere. But then, it all starts to go completely, catastrophically wrong. That's the puzzle we're putting together today.
And look, we're not just talking about some weird one-off case. This was a first, as in never before seen in the medical books kind of first. The Journal of Orthopaedic case reports published this, and it left seasoned surgeons just scratching their heads, forcing them to look way beyond the operating table for answers.
Okay, so let's set the scene. We've got to start at the beginning, with the patient and the surgery that was supposed to give her life back.
Our story centers on a 65-year-old woman, and she was really suffering, We're talking severe stage 4 osteoarthritis in both knees. That means just constant pain, grinding, cracking. She could barely move. She was the absolute perfect candidate for a double knee replacement.
And she wasn't just getting your standard run-of-the-mill knee replacement. Nope, they were bringing out the big guns for this one.
She was having a robotic-assisted total knee arthroplasty, or TKA. This is cutting-edge stuff. Basically, the surgeon uses this incredibly precise robotic arm to make the bone cuts and place the new knee components with near-perfect alignment. The whole idea is to get a better fit, a faster recovery, and a knee that lasts a long, long time.
So, why go this route? Well, it makes a ton of sense, right? The robot is crazy accurate. Doing both knees at once means one trip to the OR, one round of anesthesia, and one single combined rehab process. Everything about this plan was pointing toward a home run, a great long-term solution.
And at first, everything was perfect. The surgery back in December 2023, it was textbook. You look at the post-op x-rays and they are beautiful, perfectly aligned, perfectly balanced implants. By every single measure, it was a total success. But, and you knew there was a but coming, this is exactly where our story takes a very sharp turn.
Because in the weeks and months that followed, a really strange and deeply puzzling problem started to emerge.
Let's just walk through how this all unfolded. December, surgery is a success, she starts recovery. Fast forward 3 months, she's having trouble walking. Then, at 8 months in, and this is wild, the right knee just dislocates out of nowhere. And if that wasn't shocking enough, after they fix that one, just 3 months later, the left knee does the exact same thing.
And I really want to stress this part. This was an atraumatic dislocation. That's the medical term for it just popped out on its own. There was no big fall, no accident, no major injury. The new knee joint simply slipped out of place.
So you can imagine the medical team, right? The first dislocation, they're baffled. But the second one, that confirms it. This is not a fluke. This is not bad luck. 2 perfect, high-tech knee replacements have failed in the exact same, bizarre way. They knew they were missing a giant piece of the puzzle.
So this kicked off a huge diagnostic journey. The doctors had to start thinking way, way outside the box here.
Which brings us right back to that massive question. How could 2 perfectly installed, top-of-the-line knee replacements just fail like this? What kind of force could possibly be at play?
So the team did what any good medical detective would do. They started ruling out the usual suspects. Was it a surgical error? Nope. The x-rays proved the surgery was flawless. Okay, well maybe the implants themselves were faulty? Nope, the components were totally fine. What about a deep infection around the joint? That's a common culprit. But again, all the tests came back clean.
So if it wasn't the surgery, and it wasn't the hardware, and it wasn't an infection, what on earth was left? Well, it turns out the problem had nothing to do with her knees at all.
The real issue was happening in the body's command center. It was a breakdown in that incredibly complex communication network between her brain and her muscles.
After a whole battery of tests, a full neurological workup, they finally had their answer. The patient had an undiagnosed neuropsychiatric illness, a late-onset Parkinson's disease with some features of Alzheimer's. And this condition was causing something called hypertonia,
which basically means her muscles were just incredibly, uncontrollably stiff and tense all the time.
And here's how it all connects. That hypertonia was making her hamstring muscles so unbelievably powerful and tight, with no opposing muscles to balance them out, that they were physically yanking the upper part of the knee implant backwards, right off the lower part. Her own body was tearing the surgery apart from the inside. Just incredible.
So what can we all learn from this? Because this case, as unique as it is, has a really powerful message for anyone in medicine today.
It really boils down to this classic clash, technology versus biology. On one side, you've got this amazing robotic precision, perfect alignment, everything done by the book. But on the other side, you have the beautiful, messy, unpredictable reality of human biology. An undiagnosed condition created forces that no engineer could have possibly planned for.
And the authors of the case report, they say it best. Their main clinical message is that this case proves we absolutely need thorough neuropsychiatric evaluations, especially in older patients, before they go in for a major surgery, like a double knee replacement. It's all about spotting these hidden risks before you ever get to the operating room.
And that really is the big takeaway here, isn't it? A knee isn't just a simple hinge that you can swap out. It's part of this complex, integrated system. This case is just such a powerful reminder that you can't just treat one part of the body in isolation. You have to see and understand the entire patient, mind and body.
So, this story leaves us with a really vital question to think about. As our surgical tools get more precise, as robots and AI become more common in the OR, how do we make sure our focus stays broad enough to see the whole complex human being at the center of it all? It's a critical balance to strike as we move into the future of medicine. Thanks so much for tuning in.